Good evening, everybody. It is Sunday, May 21st, 2023. This watch says that it is 9:30 in the evening, and my phone says that it is 9:31 in the evening. Okay, this is part 12 of the preface or preface of Dr. David D. Burns, MD, the Feeling Good Handbook. Third, the percentage of the patients who dropped out of the bibliotherapy studies was very small, around 10%. This is less than most published outcome studies using drugs or psychotherapy, which typically have dropout rates from 15 to over 50%. Finally, the patients developed significantly more positive attitudes and thinking patterns after reading Feeling Good. This was consistent with the premise of the book, namely that you can defeat depression by changing the negative thinking patterns that cause it. The researchers concluded that the bibliotherapy was effective not only for patients suffering from depression, but it might also have a significant role in public education and in depression prevention programs. They speculated that Feeling Good bibliotherapy might help prevent serious episodes of depression among individuals with a tendency toward negative thinking and mild levels of depression. While the results of this study were encouraging, the 3-month follow-up evaluation was still not long enough to determine if the antidepressant effects of Feeling Good would last. Motivational speakers can get a crowd of people fired up and feeling optimistic for brief periods of time, but these mood-elevating effects often don't persist. The same problem holds for the treatment of depression with psychotherapy or with drugs. After a period of time, many patients relapse. Some develop a pattern of chronic depression that can be difficult to treat. These relapses can be devastating because patients feel so demoralized and hopeless. In the recent study published in the summer of 1997, investigators reported the results of a 3-year follow-up study of the patients in the study I just described. The authors were Dr. Nancy Smith, Mark Floyd, and Forrest Scoggin from the University of Alabama, and Dr. Christine Jameson from the Tuskegee Veterans Affairs Medical Center. The researchers contacted the patients 3 years after the completion of the bibliotherapy study and administered the depression tests once again. They also asked the patients several other questions about how they had been doing since the study. The researchers learned that the patients had not relapsed but maintained their gains during this 3-year period. The scores on the 2 depression tests at the 3-year evaluation were slightly better. Many of the patients, 58%, said that their moods continued to improve following the completion of the initial study. Okay, so that is all for part 12 of the preface or preface of the Feeling Good Handbook, David D. Burns, MD. If you like this content, like this video, comment below. Thank you very much, and thank you for watching.